So in this particular case, is a 63-year-old teacher, currently active, still teaching, still working, still having a family life. And there was an unpredictable nature to her off episodes. So just going up on our medications uh, w- didn't really make a lot of sense. Although sometimes you can increase the medicines and also use an on-demand therapy. We chose the inhalation levodopa powder to manage her off episodes because number one, she's still very active. It was very easy for her to put together and be able to administer it fairly quickly throughout her day. She had a good idea of the start of her off episodes. Yeah, she kind of starts feeling the tremor, and then if she doesn't get control of it, she knows that the rest of the day becomes more difficult. And I think that's really one of the important parts about the inhalation powder is recognizing that you're beginning to have an off episode and being able to inhale it. As long as somebody does not have COPD or asthma, which our patient did not have, and no other lung problems, this was an appropriate use of the inhalation powder to manage her off episodes. So I think this was a good choice to be able to give her to get more control of these off episodes. The SPAN PD trial looked at patients who were having off time and off episodes, and these patients were able to use this inhalation levodopa powder up to 5 times a day. The average time of using it was about 2 times per day in the SPAN PD trial. And the SPAN PD trial also showed that if you used it at the onset of when felt to have an off episode, within about 10 minutes, with a peak effect at 30 minutes, you saw a resolution of these off episodes or improvement in the Unified Parkinson's Disease Rating Scale. So it really does give us a new tool to be able to help treat our Parkinson's disease patients to get better control of these off episodes. And this is on-demand therapy. And again, even though patients were able to use it up to 5 times a day, the average was about 2 times per day. So it lets our patients choose when to manage these off episodes. And again, some of our patients' off episodes are very unpredictable. Some of them are a little bit more predictable. And again, there could be a gastrointestinal component. They can be a little bit late on their medication, or they could be wearing off. And again, we can do more than one thing for our patients. And I think that's what is new to Parkinson's. I think we always need to take a look at those maintenance therapies. But when these off episodes come, and they're going to come in most of our Parkinson's patients, they have something to be able to get better control of their symptoms and overall better quality of life. So I think when you're using this inhalation levodopa powder, I think it's very important to go over how to administer it. Is you are using a device to be able to inhale. So it's an inhaler. It's very simple to put each capsule and put it together. But the actual inhalation, when you bring it up to the mouth and you have to take a deep breath in, deep breath out, and then a nice slow deep breath in and then hold it in. And you want to hear for that whirl. So definitely going over that with the patient. There's a great video online how to use it. Some patients will cough when you use this. I think with a smoother, slower inhalation, there's less of irritation to the back of the throat, so you see less cough. So the first time, I think I see 100% of people just cough a little bit. It's very mild, but then you get used to it, and then it gets better from there and there. I think each patient learns a little bit. I usually require my patients to drink a little bit of water afterwards. Also, sometimes drinking a little water right before can sometimes diminish that feeling of dry powder hitting the back of the throat. So these are some of the things that I do for my patient. But I think a nice slow inhalation and then holding your breath for a few seconds, about 5 seconds afterwards, really led to the best efficacy for my patients and more ease of use with it. If powder is left inside the mouth, that can oxidize, so it can turn the tongue or some of the teeth black. So I usually ask them just to drink a cup of water after inhaling. My personal experience with this is that our patients who are able to use this really love it. Again, they get control of their symptoms. So every patient is different, and I think there's some patients who are better inhaling than others. But I think it's something that's out there for our patients, and I think as a neurologist, I've become more comfortable offering on-demand therapies for our patients in addition to giving them their maintenance treatment. So it's a real important to be offering these patients our different medications that we have. There's more than one drug available for Parkinson's disease, so I think it's really important to have these discussions with our patients and get them used to more of a cocktail approach or a rational polypharmacy approach to treat off time and off episodes in Parkinson's disease. So I think the biggest unmet need in treating off episodes in Parkinson's is really all about education. No matter what we do as physicians, or no matter how many medications our Parkinson's disease patients take, over time they are going to be having off episodes. So I think it's very reasonable to do the normal things that we normally do by increasing carbidopa-levodopa, by using COMT inhibitors, MAO-B inhibitors, dopamine agonists, and now A2A antagonists. So all of these things are aimed to reducing off time, improving on time. But no matter what we do over time, we're still going to have these off episodes. So thinking about the rationale of having those maintenance therapies and then on-demand therapies. So right now we have 2 on-demand therapies, and I think the future we're going to see other on-demand therapies coming out, and it's really linking up our patients to the appropriate on-demand therapy. So, and I think this is what we're going to be learning more and more, which on-demand therapy is going to be best for a particular individual. So I think we as neurologists have to start getting more comfortable in approaching Parkinson's disease as having a maintenance therapy and an on-demand therapy.